on the board of the Dalmatian Club of America and DCA, and also chairman of the board of the AKC Canine Health Foundation. Before we get started, a couple things. First, I want to thank Ann Ball for increasing the interest in this topic and getting everybody on board and really getting the ball rolling. So thank you, Ann. And we also want to thank Lori Isaacson for volunteering to live stream this. And just a warning that since this will be all recorded, any comments you make to your friends or neighbors will be picked up by that and will be transmitted worldwide. So keep that in mind. So welcome to the 12th annual Betty Garber Memorial Lecture Series. And Betty, my mom, many of you knew, was a longtime Dalmatian fancier, started coming to DCA Specialties with me in 1966. And she served on the Dalmatian Club of America Board of Directors and was secretary of the club, and was an AKC delegate for 17 years. One thing, she certainly loved everything about Dalmatians and about Dalmatian people. Now tonight we have with us Dr. David Twedt, talking about copper storage disease. He earned his DVM at Iowa State and his internship and residency at the Animal Medical Center in New York City. And he's a diplomate of the American College of Veterinary Internal Medicine and a professor at Colorado State University. He has well over 100 published papers in respected journals and editor of textbooks. He's spent more than 40 years researching the causes and treatments of copper toxicosis in dogs. More than 15 years ago, he published a paper on 10 cases of copper accumulation in the liver of Dalmatians. So this is not a new phenomenon. He's on the research team that is working on the current Canine Health Foundation grant studying copper storage disease in Dalmatians that is funded by your DCA and DCAT. It's how honored we are to have with us such a world-famous veterinary researcher here tonight. He's been president of the American College of Veterinary Internal Medicine. He's been chairman of their board. He's been president of the Comparative Gastroenterology Society. So please welcome Dr. David Twedt.
I'm going to see if this, can everybody hear me?
Yes. Stay there.
Good. Well, I'm going to see how this works. I feel like I should be up here singing a song or something. I'll tell you, it's really a great pleasure to be here and be able to tell you a little bit about some of the work that we've been doing. And Dr. Garvin didn't tell everything about me. And this is my family. And this is my wife, Liz. And she's a veterinarian, and she has a little practice outside of Fort Collins and has a partner in that practice. This is my son, Ryan. This was back in 2006. Ryan loves animals but had no desire ever to be a veterinarian, and he went to college in San Francisco, and he wants to be a motion picture and television. He wants to be a screenwriter. So these are our dogs. I wonder if you could turn these front lights off so people can see a little bit better.
Can you also turn the volume up a little?
Turn the volume up?
A little. They're having a hard time hearing.
Yeah, I don't know if I can do that. Maybe someone can play there with the volume. But anyway, a few years back, I had a friend that had a border terrier, so I decided to buy a border terrier. And so that's Annie. And then we had Annie for about a year, and my wife was involved with the Border Terrier Club, and someone called her up and said there's a border terrier that needs to be rescued down in Denver. It's got heart disease. If it's in bad shape, just euthanize the dog. That turns out to be Rusty. Rusty had a pulmonic stenosis, and we got that fixed, and he was healthy as can be. And then we got another one, little Strider. And my wife deals with a lot of breeders and a lot of people that are in the shows, and so she decided she'd like to see what it was like to show Annie. And so Annie went to a dog show, a local one, and actually got a blue ribbon, first place. However, there were only 2 border terriers. And then afterwards, we went to a couple of other shows, and we got last place in every one. We found out our dog doesn't walk straight, the tail's not right, one ear is up and cockeyed, and so we kind of retired from that. But Annie lived to be 17. Little Rusty, that had the heart problem, lived to be 15. And they both ended up having this condition that's called biliary mucocele, which the gallbladder just gets filled with lots of thick mucus. And we actually, it's kind of ironic that we wrote one of the first papers on biliary mucoceles, and then lo and behold, 2 of my 3 dogs had this problem. So Annie died about a year ago, and then one of the breeders that we know very well had a dog that he was actually a champion, but he was a little bit too big for her breeding stock, and that was Seamus, and so they gave us Seamus, and so he's been like our best dog ever. And then 3 months ago, we were contacted by the Border Terrier people, and there was a little Border Terrier, Blueberry, that her owner had died and they needed a home, and she was about 9 years old, so we adopted her. We've had her for 3 months. She's lost 3 pounds body weight. We pulled out 14 teeth, took care of her otitis externa, and she likes to pull all of her toys out of the box, but we can't get her to put them back in. So that's my family, and we also have 2 cats and 2 turtles. But what I want to do is get back and talk to you a little bit about what we know associated with copper. And so I'd like to talk a little bit about copper in general, some of the other breeds, just to let you know that you're not alone in this problem, and then talk specifically about the what we found thus far with the Dalmatian and some of the things that you can do as far as biopsy and diagnosis and so forth. And then, if we have time, we'll do some questions at the end. So, with that, just to talk about copper, copper is essential for life. All animals need copper. And copper is used in all these different enzyme functions. It has antioxidant functions. It helps in metabolism, nerve transmission. So there's a lot of real important needs for copper. And we usually get copper through the diet, so we take it in. And so what happens is copper comes in through the diet, and in the intestinal tract, copper is absorbed, and it goes directly to the liver. And the liver is the organ that regulates the amount of copper that goes into the body and leaves the body. Once that copper goes into the liver cells, the liver will take that copper, and then they will either send that copper out bound to a protein that's called ceruloplasmin that takes it out to the rest of the body. And then any excess copper is then excreted out in the tiny little bile ducts, we call them cannuliculi. And then these go into the gallbladder and then go back into the intestine and on out. So the liver is very important in regulating copper metabolism. And we can see copper accumulation from a number of reasons, one of which is we can see it with just dietary, where there's increased copper intake. We can also see it with metabolic disease, and that would be defects in metabolism of copper in the liver, and we know that that definitely occurs with the Bedlington Terrier. And then we can sometimes see copper accumulation secondary to liver disease, where the liver has problems excreting stuff into the bile. That seems to be a very, very minor reason for copper accumulation, much more common in humans as well as in cats. So in the liver, and unfortunately you can't see this very well, but copper goes in, this is a liver cell. And copper goes into this liver cell with a little carrier mechanism that's coming from the intestine. And then there are a number of proteins here that move copper through the liver cell. They can either send copper out to the rest of the body, or these proteins will excrete copper into the bile. And these proteins are very important, and we think that these proteins may be the reason that copper accumulates, that they have a defect in some of these carrier proteins. We call them chaperones, and so they kind of move the copper around through the liver. And the first condition that was associated with copper was in humans, Wilson's disease. And this is a hereditary disease. It's an autosomal recessive disease. Probably 1 in 100,000 people get this disease. And copper accumulates in the liver, and as it accumulates in the liver, it causes liver cell damage, because too much copper can be toxic to membranes and to the liver cells, and they can develop cirrhosis of the liver. Uniquely in people, they also can accumulate copper in their brain and develop neurologic problems. And this is something that we usually see, or they usually see in younger, teenage, 20-year-old kids that may either present for liver problems and or neurologic problems. One of the clues with this disease is copper also will often accumulate in the iris of the eye. And you can see this sort of brown copper color in the iris, and these are called Kaiser-Fleischer rings. And so oftentimes your doctor can make that diagnosis just by looking at your eyes and seeing those copper rings in the iris. I have yet to see this in a dog with copper accumulation, but it's unique in humans. And so the Wilson's disease was found to be a genetic defect in copper metabolism. And basically, this was identified back in 1993. They identified a specific gene. The gene is called ATP7B. It's a gene that is a chaperone type gene. And Dr. Diane Cox, previously at the University of Toronto and then at the University of Alberta, where we're doing a lot of our studies, was very involved in looking at these genes, and she was able to find well over 100 different variants of this one single gene. And we think that some of those may be causing problems, some of these variants may not at all, and that may also be true in our dogs as well. So anyway, she was very involved in looking at this gene for humans. So, and that gene, and I don't know if you can see this here, but copper goes in, and this ATP7B carrier protein is right here. And what it's involved in is excreting copper into the little bile ducts, and also taking that copper and attaching it to a protein that takes it out through the rest of the body. And so in humans, they have very low levels of ceruloplasmin. We haven't identified that yet in dogs, and they accumulate copper in their liver. And then back in 1975, there was a woman by the name of Mariana Padula. She lives in Florida, and she described that some of her Bedlington Terriers were dying from liver disease. And she thought that maybe this was something that was unique in Bedlington Terriers, because she had a number of them die. And so she contacted, I think, every veterinary school in the U.S. saying that there's something wrong with Bedlington Terriers. Back then, there were a lot of people that did not believe that that was the case. Well, at the University of Minnesota, they happened to were contacted. They happened to have a Bedlington Terrier in the clinic at that time. That dog ended up dying. And on the pathology, they found all these funny-looking granules in the liver, and they couldn't figure out what they were. So they put all these different stains on to stain these granules. And what they found is that it stained very positive for copper. And this is a copper stain, and all this little red stuff here are granules filled with copper. And so that was the first breed that was identified associated with this problem. And we thought actually that maybe the Bedlington Terrier would be a good model for Wilson's disease in people, but actually we found that it's not. It's a little bit different. But what we know is with the Bedlington Terrier is that copper will increase with age. And probably the average age that we usually see these dogs is probably 7 and 8 years of age. There are some animals that are affected that die from some other disease and we never diagnosed it. What we do know is that it can successfully be managed with chelation therapy, and that's drugs that will bind to the copper and take the copper out of the liver. And what we now know is that it is an autosomal recessive defect, that it is associated with a different gene, which makes up about 95% of the defects, and it's a common one gene. And essentially, years ago, we used to think that probably 60% of the Bedlington Terriers were carriers for this problem. Today, I see no Bedlington Terriers, and that's because of genetic studies and eliminating that gene from the breeding stock. So it's almost completely gone in the Bedlington Terriers. And that would be a goal for our Dalmatians as well as other breeds as well. And this defect here's the human defect, the ATP7B carrier protein, and this is the common. So it's a step behind or beyond the gene in humans. And that makes up about 95%. We found, other people have found another gene which is less common, but this is the major one that most people can test for. You can go into vetgen.com or some of these other places and you can test for that. And so it's no longer in that breed. So then there's a number of other breeds that have been in the literature as well associated with having a predisposition for increased copper. And we talked about the Bedlington Terrier. The Doberman Pinscher does accumulate copper. Recent studies have also found that the Doberman Pinscher also has an autoimmune hepatitis, and many of those dogs also have copper. So there may be some interrelationship in the Doberman Pinscher. The West Highland White Terrier is kind of a unique breed that there's certain areas of the country where we see quite a bit of this. And no one has really done a lot of studies in the Little Westie. Probably the breed that is the most common that I see is the Labrador Retriever. And they have a genetic defect in copper metabolism as well. And when we talk about copper, we usually measure copper in the liver, and normal coppers are reported to be someplace in the range of 120 to 400 micrograms per gram dry weight. Some people call it parts per million, and that's usually the normal range. And we usually think toxic levels can get, well over, you start to see toxicity when levels get over 1,000. And some of these Bedlington Terriers can have levels of 10,000 or 12,000, so really, really high copper levels. But the breed that we see the most commonly, probably because the Labrador is the most common breed, I think, in the United States, and I think also in Europe, is that we know that they have a hepatitis that is associated with copper, that studies have found that they have a gene defect, the ATP7B defect, which is the same gene that humans have, but they also have a mutation that appears to be in males that may, and this is an ATP7A, that may actually protect those males from copper accumulation. What we know is that these animals develop hepatitis, they can go on to develop cirrhosis of the liver, they can end up dying from end-stage liver disease. And we know that we can use a copper chelator, penicillamine, and penicillamine, like I said earlier, pulls copper out of the liver, and it's excreted in the urine. And one little study looking at 3 months of penicillamine in 33 dogs with their average copper levels about 1,200, definitely in that toxic range. In 3 months, that almost have those copper levels, not quite getting them down less than 400, but probably got them out of that toxic range. What we also know is that there seems to be a relationship with this toxicity and having clinical signs in animals that are on a high copper diet. And we'll talk more about diet in a few minutes. We also know that if you get rid of the copper out of the liver, that in these dogs, if you just put them on a low copper diet thereafter, they can live a normal life and they don't accumulate copper. So it has to be the gene plus a high copper intake that causes this disease. The average copper levels in Labradors, I think, are about 1,400 is what we often will end up seeing. So it's above that 400, but not like the 10,000 that we see in the Bedrington Terrier. So we did a little study where we were seeing, it just seems like, we biopsy dogs and we'd always measure copper levels in their liver, and it just seemed like, a lot of dogs had lots of copper in their liver. So we went back through our pathology records and we looked at dogs that had liver biopsies sent to Colorado State University that also had copper quantitation. So they had to have both. They had to have the copper histopathology, but they also had to have copper quantitation. And in a 4-year period of time, there was over 2,000 cases that had both. And then we went back and looked at their copper levels, and half those animals had levels above 400. And this is kind of that scatter plot of copper levels in those dogs that were submitted to our pathology lab. Now again, all those dogs were probably suspected of having liver disease. And the average was 2,100. We think they start to see toxicity at about 1,000 or higher. So we actually went back and looked at dogs that had copper levels over 1,000, and in that 4-year period of time. And that made up 21% of the cases. Their mean copper levels were 2,000, definitely very, very toxic. And what we found is when we went back and looked at breeds, that included 135 Labradors with their mean copper levels of 1,400. We also, though, had 14 Dalmatians in that group. Their mean copper levels were 3,700. Dalmatians tend to accumulate higher concentrations of copper as compared to the Labrador and to the Doberman Pinscher and other breeds. And I think they're almost approaching maybe similar to what we might see with the Bedrington Terrier. And we might see that maybe it might be a very similar gene associated with that. So one of the things that I did an internship and residency at the Animal Medical Center in New York City, a big 8-story hospital where we saw 80,000 cases a year, and it was in the prime time. And we were starting to see Bedrington Terriers, and I was very interested in liver disease. And I got hooked up with this guy, and his name is Ermin Sternli, and he is the world's expert on Wilson's disease in people. And he thought that very definitely the Bedrington Terrier might be a good model for Wilson's disease. And in fact, he actually adopted or purchased a couple of Bedrington Terriers as his own pets, and he never had animals his entire life, and now was absolutely crazy about these dogs. But, and I worked in his lab for a couple of years studying copper and all that, and then I decided I wasn't really a researcher, more of a clinician, but he was one of my mentors, and one of the things he kept telling me is, they put too much dang copper in dog foods. And he also told me, or reminded me, that in humans with Wilson's disease, their copper levels are about 50 to 75. And people that get Wilson's disease, their copper levels are 400 or higher, maybe never over 1,000. And then, we know that dogs are about 200 to 400. But he also told me that back in the 1930s, copper levels in dogs were 50 to 75, the same as people. And they use the same test for that, so it's not a testing problem at all. And the question is, could it be, back in the 1930s or 40s before World War II, we just fed our dogs table scraps. And now we've got commercial dog foods. And we've been working or trying to convince AFCO and the NRC about copper in the diet. And we think that they do put too much copper in the diet, and some animals that can't tolerate copper, the diet may contribute. We definitely believe that's the case for the Labrador Retriever. And so AFCO comes up with these recommendations, and these recommendations actually are based on young-growing puppies. And in fact, young-growing puppies require more copper than an adult dog because they don't get copper from the mom's milk. And also, toxicity levels weren't even based on dogs, they were based on pigs, and not even based on dogs. So they came up with these recommendations of the minimum and the maximum amount of milligrams per kilogram dry weight in the diet. And then in the 1997 or thereabouts, the recommendation was that we change the copper supplement in the diet from a copper oxide to a copper chelate. Copper chelates are much less expensive, they're more biologically available. Copper oxide, animals only absorb about 5%. The copper chelates, they can absorb up to 100% of the copper. So we're putting a lot of copper in, and the average dog food is probably getting 15 to 25, and then the copper supplementation with the new chelates, they're probably absorbing a lot more copper than they should. Right now, the only diets that are low in copper are the liver diets, and that's because they're special prescription diets, so they don't have to meet this AFCO requirements. We've sent some letters to them. We're trying to convince them, the internal medicine group, but right now we think that a 10-kilo dog, a 20-pound dog, probably consumes twice the amount of copper as an adult human would consume every day. So we think that is a problem that's contributing, and maybe that's why, some of these dogs that have all these high copper levels, could it be because of the diet? They're just taking in too much. So we don't know. So I sort of got involved with the Dalmatian, way back in the early, late 1900s or late 1900s, in the late 1990s and in the early 2000s. And the first case that I dealt with was a Dalmatian that was very, very sick, and we just really struggled really hard for that dog. And the dog did live for about a year and a half afterwards with therapy, but eventually did die from his disease and had excessive amounts of copper in his liver. And so we treated him like we would treat a Bedlington Terrier. Then the second Dalmatian I saw, in Fort Collins, Colorado, we have the Budweiser Brewery. And one of the brewery dogs was sick and had liver disease, and we identified that it had copper in its liver as well. That dog's name was Brew. And then we found some papers, and there was a paper of a single case reported in Canada, and then there was another case, I think, out of the University of Pennsylvania, and another paper on a single Dalmatian. So we went back in our records, and we came up with 10 cases, and certainly we've seen a lot more since then, but what we usually found is that these dogs tended to be a little bit younger than what we would see with the Bedlington Terrier, that the average age was about 6 out of all these dogs that we saw. In that 10 cases, there was one mother and son that were affected in our pathology files. We had one dog that developed acute liver damage at the time of whelping, and I do think that sometimes severe stress can precipitate the release of copper and copper damage. Most of these dogs present with gastrointestinal signs, usually anorexia, vomiting. They often have lethargy. Sometimes these animals can get icteric, and their sclera, and their membranes will turn yellow, and that's certainly an indication of liver problems as well. When we looked at those Dalmatians, remember again, 400 or less is normal. But we had some that was almost up to 10,000 with, out of those, their average copper levels were 4,000. Much higher than the Labrador, probably about the same, maybe not quite as high as in the Bedlington Terrier, and certainly much, much higher than the Labrador Retriever. So my impression is they tend to be a little bit younger, they do accumulate lots of copper in their liver. So how do you diagnose it? Well, one of the things, and if you have a dog and you want to, we don't have genetic testing yet, and what I usually recommend people to do is just do a routine health screen every year with your veterinarian, and that would include a biochemical profile. And one of the early markers of this disease is an increase in one of the liver enzymes called ALT. And ALT is a liver enzyme that just kind of floats around in the liver cell. And anytime you have any hepatocellular death, where the liver cell dies or gets very sick and degenerated, then what happens is that ALT will leak out into the bloodstream. So it's an indication of liver cells being sick or dying. And certainly, ALTs can go up for many, many, many reasons, but persistent ALT increases, and if I had a Dalmatian and my routine health check, it was abnormal, I'd recheck it again in a couple of months, it's still abnormal, I would probably investigate that. Definitive diagnosis, unfortunately, at this time requires a liver biopsy. Some people have tried to do a fine needle aspirate and cytology, but that is not adequate. And so you can do your liver biopsy either as a surgical biopsy, and sometimes people will, at the time of a spay, get a liver biopsy. With the Bedlington Terrier, I will tell you that to identify copper, they have to be over a year of age. Sometimes you don't see excess copper until they get to be a year of age or older. I don't know the answer in Dalmatians, but I would say probably any animal over a year of age, routine health checks would be what I would recommend. You can also do an ultrasound-guided needle biopsy. One of the problems with the needle biopsy, it's very minimally invasive, but sometimes you can't get quite enough tissue for the copper quantitation. What we normally do at Colorado State University, and there are a lot of veterinarians that do this as well, we give courses on how to do this, is laparoscopy. That's where you take a scope and you go in through little portals that are about the diameter of a pencil under short-acting anesthesia, and you can look at the liver and you can take a biopsy. And so this is just a little demo of a liver biopsy. And essentially, again, these are 5 millimeter diameter little biopsy cups. And we can pass those in through a portal through the abdominal wall. We can go down and look at the liver. And then here we are sort of lifting up the lobe of the liver, and we open up our little biopsy forceps. And we can take off a small piece of tissue that's about 5 millimeters by 10 millimeters in diameter. We usually take about, I would say 4 biopsies from different lobes of the liver. One of the nice things about this technique is, one, we get a nice piece of tissue, and 2, we can watch the area and make sure that it's not bleeding excessively. And if it is, we can do measures to stop the bleeding. Rarely does that ever occur. We always check clotting times and so forth. But here we are going back and looking at the area that we biopsied, and it's just a minute amount of blood that from each biopsy. We can, if it does bleed excessively, we can use this material that's called gel foam, that we can actually take a little bit of that and stick it into the area that's bleeding, and usually stimulates coagulation. So that's one of the techniques that we will do, and so we do these quite frequently. They usually come in the morning and they go home in the late afternoon. And usually they're about 95% back to normal or pre-biopsy the next day. So if you do a liver biopsy, what can you do? And one of the things that is very important is to look at the histopathology. That's looking at it under the microscope so you know the pathology and you know where the inflammation is, how extensive it is, the location of the inflammation. And that will tell you if you're dealing with hepatitis or other types of problems or cancer or whatever. With the biopsies, we generally will do a copper stain. And there are two different copper stains that we normally use. At our hospital, we use the rhodine stain, and we'll put that copper stain on, and it will, the copper granules will stain sort of this orange type color. And that will give us an estimate. It's sort of a guess on how much copper is in the liver. And so we usually grade it from 1 to 5, and with increasing number, that means the copper concentration is much higher. I think for us to be able to definitively know and also to determine how we best treat these animals, we usually will do copper quantitation. And that's where we take a small chunk of the liver, again, like one of those liver biopsies, at least a 5 by 5 millimeter diameter size or larger. And we usually put that in a copper-free tube, and this is just a blood tube, a coagulation tube, and we put that in the tube. And what we do is we measure that in micrograms per gram dry weight. So that's, and you can send that off to the pathology lab. It does not need to be sent overnight, Federal Express. It doesn't have to be on ice, because when we get the tissue, we dry it out. And once we dry it out, then we do that. There are a couple of labs that do on a wet weight basis, so they don't dry it out. Those are critical to get them to the lab. There are a couple of places that do that. I know University of Utah does that, and a few other places. I would not recommend that because I think it's a little bit less accurate. And it also is possible, if a biopsy was done on your animal and copper was not collected, if there's enough tissue left over, and when we make a microscope slide, we put the tissue in some paraffin, and then we cut off very thin slices, and then we stain that and look at it under the microscope. Well, at Colorado State University, and I think we do it for everybody in the rest of the country, is we can take that little paraffin block. Most labs keep it for a number of months. We keep them for 10 years, and we can actually melt out that paraffin and measure the copper levels, and so it can be fairly accurate. I have had some people contact me and they say their animal died and they want to know if it's affected or not. And for histopathology, the sample has to be relatively fresh and put in formalin tissue. Otherwise, the tissue starts to autolyze or degenerate. However, you can measure copper levels in a patient that's, died, several days earlier by just taking a little chunk of that tissue, putting it in a copper-free blood tube, and sending that off. And what we do is we dry it out, so it doesn't matter if it's already starting to break down. It's all based on dry weight. So we can, after the fact, measure the amount of copper in the liver. One of the other clues that might be a clue that maybe a Dalmatian has copper toxicity is we have seen a number of these Dalmatians, and I think in that first paper of 10 cases, a couple of these dogs had sugar in their urine, and they didn't have high blood sugar. And what we now know is some of these dogs, the copper will also accumulate in the kidney tubules. And so this is a biopsy of the kidney, and this is a kidney tubule right here, and this is one here, and this is a copper stain. And what we do know is that it causes a syndrome that we refer to as a Fanconi type syndrome, where they lose sugar through their kidneys. We also know that if we successfully treat these animals, their kidney problem resolves. And so their sugar in their urine resolves. So that might be a clue as to what's going on. So the therapy for animals that have excess copper in their liver, one is copper chelation. And the drug that we normally use is penicillamine. And penicillamine is given orally. And what penicillamine does is it actually pulls copper out of the liver, and then that penicillamine attached to that chelator then is excreted out through the urine. So it's a way of getting rid of that copper. Now, if your veterinarian writes you a prescription for penicillamine and you go to Costco's, which I just checked the other day, each tablet or capsule is $250. It used to be $1 capsule. $1. And now it's $250. It's just like those EpiPens, the prices went up. So to treat a dog for 3 months is like $6,000 or $7,000. So what we do is we get penicillamine from veterinary compounding pharmacies. And the cost is, again, about $1 a capsule or thereabouts. So you don't want to use the human product, or if you go in, you'll have a heart attack if you get the pill. There are some others that we're experimenting with. We did a whole bunch of experimental copper chelators in years past. There's another one that may be effective. I've treated a couple of dogs with that. Zinc can be given. It should not be given with penicillamine, but zinc given orally will block copper from being absorbed. So that is a way of maybe trying to block copper absorption, but you don't want to give it with a chelator because the chelator will also bind to the zinc. We usually always will use a low copper diet, and we usually will use antioxidants because there is oxidative damage, and that seems to help somewhat. So penicillamine, our dose is about 10 to 15 milligrams per kilogram given twice a day. We usually would like to give it on an empty stomach. It can cause nausea and vomiting in some patients. If that's the case, we usually try to back off on the dose. We usually may try to give it with a little bit of food. I like to give it with a little bit of cottage cheese or milk products. And we usually, always like to rebiopsy these animals, but sometimes we can't. And I usually will treat these dogs until their ALT levels get back to normal. That tells me the liver cells are not dying. But ideally, rebiopsy those. As far as low copper diets, the only commercial available ones, all the other commercial diets have too much copper, or Canon Hepatic and Hill's LD, which is a liver diet, or homemade diets. And homemade diets are usually not supplemented with additional copper. There is a website that I like that's called balanceit.com, and it's out of Davis. And they have a number of homemade diets, and they have homemade diets that are low in copper. And they also do sell vitamin mineral supplement for homemade diets that is copper-free. So you can get your regular vitamin mineral supplements with that. So that's kind of what we know at this point in time. So we were lucky enough to be funded to try to understand the genetics of copper toxicosis through the benefit of you all that have helped us do this, and with the Canine Health Foundation. And this is kind of the team, certainly with Ann and Cindy and Tracy, that's been really important in helping us. And Charles, your help with the AKC and so forth, helping us get this funding to do this. And so this is kind of the team. And it's head up by Dr. Mason. He's part of the Division of Gastroenterology at University of Alberta. They are very involved with genetics. They've been very involved with Wilson's disease, with the Bedlington Terrier stuff. And so they're the prime people to be involved with that. And probably the other person, or probably the person that's the most important, is Georgina McIntyre. And she has been doing a lot of the genetics. She's probably talked to lots of the breeders all over, and she's working on the pedigrees and so forth. And so she is very, very important, as well as another geneticist, Dr. Southard and then myself as well, probably more as a clinician type person. And so that's kind of where we're at. And so the first phase of this study was to collect and evaluate all this data. And so, with the help of all the breeders and owners, and then contacting us, and I think Ann's been really instrumental in having people contact us, and a lot of liver samples and DNA have been sent to Colorado State University, and we still are paying for shipping and histopathology and copper quantitation. But we also need the genetics, so DNA samples, which is just a blood sample. And then collecting pedigrees and the DNA bank from the Orthopedic Foundation for Animals, the OFA. Right now, we have collected lots of pedigrees. This is kind of a pedigree chart, which has 163 dogs. And out of that, there are 22 dogs that have confirmed copper toxicity. There's one that we think is a carrier, and then there's some normal dogs that have been biopsied normal as well. And this goes back about 12 generations. And this is an area that has our interest because this is a family of dogs where there were 4 that were affected, and one that we think is maybe a carrier, and 3 or 4 that are not affected. And so this is one of the areas that we're kind of trying to focus in on some of that genetic studying. What we know is that, and this is just basic genetics, and probably because you breed dogs, you probably understand a lot of this stuff, but there are 39 pairs of chromosomes in the dog, so there are 78 chromosomes, and on these chromosomes there are over 19,000 proteins that are encoded in the genes, and so we're looking for maybe something out of 19,000 different protein coding genes, so it's like trying to find a needle in a haystack. Fortunately, computerization has helped a lot in doing that. And our preliminary results are that we believe that this is an autosomal recessive defect. It's not sex-related, but it's autosomal recessive. And so that means that in your genes you have 2 paired genes, and someplace in one of these genes is the gene for copper metabolism. And what we think is that, at least in the carrier dog, there's one of these chromosomes that has an abnormal gene defect. And it could be a deletion of a gene, or it could be just a defective gene that then results in copper accumulation. So what that means is, if you have two carrier dogs that you breed together, statistics would say that you have a 25% chance that the dog will be affected, 50% chance that you will have carrier dogs, and 25% chance that they will be normal. And if you have a carrier dog that's bred to a normal dog, there's probably half those dogs will be carriers. And so what we want to try to do is find out which ones are the carriers, so that we don't, have this, and when we have animals that we breed together for and get the disease. So, and if you breed 2 affected dogs, then probably all your litter is going to be affected. So phase 2, which we're now starting, is to see if we can do some DNA sequencing, so we can identify candidate genes, and we can go back and look at more dogs and see if we can find the actual gene. And our overall goal is the same thing that we were able to do with the Bedlington Terrier, to develop a genetic test so that we can just send in a blood sample or a cheek swab and find out if the animal is a carrier or not for the disease. And so we hope to then be able to console breeding for this problem. And the genetics may actually help us target some of our therapies, and actually identifying the genome, it may give us some ideas of future studies as well that might be in the Dalmatian. So I guess kind of to finish up, I'd like to thank all the Dalmatian owners and breeders that have helped in this. Georgina, would certainly like to get information from any owners or breeders that have provided information on liver samples in the past. She'd like to get in touch with them, simply due to the fact that with some of these new studies, she'd like to get further permission to be able to do some of the stuff that we have done. Georgina's email is up here. I am more than happy to talk to people about individual diseases in their dog, or your veterinarian. I talk to a lot of veterinarians, and sometimes they're not completely up to date on that, so I can be reached probably better by email than calling me. And so that kind of concludes what I was talking about. And so I just wonder if anybody has questions that I can try to answer. Yes, question.
A Facebook question came up on, do you believe that a raw diet is better for all dogs and your dog's less likely to get copper storage if you're feeding it a raw diet?
The question is about feeding a raw diet, and is it better or not, and that's a whole big can of worms.
It was a question from Facebook.
That I'm not going to get into, but a couple of things we know is the liver is really high in copper. Shellfish are really high in copper. Some of the grains are high in copper. And so probably the diet contributes, but I think there's also a genetic defect with the Dalmatian. Yes?
Dr. Tweed, I find it interesting that you brought up the kidney. I will talk about my own dog. She is a copper storage dog, and you know about her. She has produced a dog that has protein losing nephropathy. And I personally know that there are some similar lines that have some copper storage in there. And is there a possibility that we have some combination genes going, that there's some things?
So the question is there, with the kidney, is it a different gene or a combination of genes? And we don't know the answer to that. I think that the dogs that are affected have very high copper levels, and I think it accumulates in the kidney. And with this Fanconi type syndrome, they can also get protein in their urine. It's mostly associated with amino acids in their urine or glucose in their urine. And it is treatable, but that's all that I can say about that.
Well, yeah.
Yeah, I don't know. Any other questions? Yeah.
In commercial dog foods, is the copper chelates, the contribution, does it come from the product or the process?
It comes from the supplements. So AFCO says that these diets should have this amount of this mineral, or this amount of this mineral, or this vitamin, or whatever. And so diets are formulated and supplemented to fit into that recommendations. So all commercial diets and I think all commercial diets have to meet AFCO requirements, are meeting that. And also, so we're talking about the chelates that are supplemented, but also the diet itself has copper. In fact, you can get copper just going through copper pipes in the water.
So, when you're looking on a bag of dog food and you see the components of that, is there something we should look for on there that we should avoid?
Unfortunately, most of the dog foods don't tell you how much copper is in the dog food. So you don't know, you have to contact the company. But I will tell you that if they meet AFCO requirements, I personally think, and many other people agree, that it's probably too much. And it probably is okay for 95% of the dogs, but if you have one of the dogs that can't handle it, then it becomes a big deal. Yes?
Jessica McMillan asks, why are we suddenly seeing the young dogs with CSD, and do you think there are different sets of genes for that versus the older dogs?
So is there a different set for maybe younger dogs?
Younger dogs and older dogs, because we're seeing more young dogs.
Yes. I don't know the answer to that.
Okay.
I think it's a spectrum of disease. I think when you look at average age, the Dalmatian appears to be a little bit younger than, at least my experience with the Bedlington Terrier. Yeah.
So if you go to the vet and you get, and your ALT is okay, then you don't need to worry about doing a biopsy or anything?
Probably at this point, if the ALT is okay, that means that you're not dealing with liver damage at that point in time. But, you know, this can manifest at any time, and so I think yearly evaluations is the thing that I would do. And we do that with any dog. Usually we recommend routine health screens because you pick up all sorts of different things. But persistent ALT elevations would be a clue. If you had a dog over a year of age and you were going to spay the dog, it might behoove you to just take a little liver biopsy, and then you would know. Doesn't tell you if your animal's a carrier, but it would tell you if the animal would be affected. That'd probably be over a year of age, though. So we don't know for sure. Way in the back.
Just because I'm so new to this is my first Dalmatian, what would you be looking for in your difference in blood work that would indicate, other than the high ALP levels, that would differentiate between copper storage and being liver failure? Like, what would you be looking for?
Well, the first thing you see is the liver cells, copper accumulates. What it does is it causes oxidative damage and kills the mitochondria, and so the liver cells get really leaky, and then they can go on and die. And an animal that is in liver failure is where you get more and more liver cells dying, and so the liver can't make proteins or albumin. They become icteric, and that is very, very advanced. And then all the liver enzymes usually go out.
As we have been developing and collecting liver biopsies for your study, sometimes we've got dogs that are above the normal level, but they're not at your toxic level. But when we get the biopsies from these dogs at a later date, they don't fit in either category, but they have produced the problem.
Yeah.
Some of them.
Yeah, and that becomes, so when I look at some of these dogs that maybe have an 800, you know, and that's where, you know, we usually say toxic at around 1,000, and that's just based on experience, but there's no research that really says that's the magic number. Those are the ones that are kind of hard to really make a recommendation on or to know about, and we do have a number of those in our study as well, and so maybe we will find that there's something different. You know, that the Labrador, there are two genes. One seems to be protective, and so maybe there's one that has some protection. You know, time will tell. Yeah.
When we're dealing with a dog that has a honey temper, because we have one in our line that did the liver biopsy, had an 800, which kind of hit me. So my thing is that how much on either side do we send biopsies and make sure the ultrasound, all those puppies, so that we have a better idea of the gene pool, about what we're dealing with as we're early into this?
Well, again, that's odd. The question is, you know, you have a dog that has an 800 and they feel fine and they're doing fine, right? It could be that maybe that's just a dog that is on a diet that's high in copper, and you see, you know, I showed you all those dogs that had high copper. A lot of those did not have any evidence of liver disease. They were biopsied for some other reason. And so we don't know for sure. In a patient like that, I would follow it very closely, and if the liver enzymes do start to go up, I think that would be one of the indications that, oh yeah, we need to further investigate this. Does that mean that this dog is a carrier? We don't know. Maybe in 3 years we'll know, or 2 years,
The
we'll know.
more dogs that we can get in that category, the liver biopsy is gonna help breakthrough that.
Yeah, I think so, yeah, very definitely.
All right, thank you.
I'm interested in the timeline for the copper study. What phase are you in right now?
Well, we've got pretty much all the pedigree stuff. We believe that it's an autosomal recessive defect, and now we're looking for the gene.
So
We're
you're in
phase two.
Where do you expect to be at the 2019 target date?
Well, you know, it's like I told you, there are 19,000 different potential proteins. Sometimes you get very lucky and you only have to look at 5 or 6 dogs and you get the answer. Sometimes you have to do a lot. And so, I don't know. But I'm leaving that to the experts at Alberta. Yeah.
If you have a female that you've spayed like at age 1 and nothing shows up as, you know, in the liver as copper, is that like reassuring in itself, or do you need to keep looking? I mean,
I think if you spay your dog at a year of age and the liver looks very normal, and a lot of this is still extrapolation from the Bedlington Terrier experience, you're probably okay. But again, I would do routine health screens on my animal.
because it could develop it later on. Correct.
Potentially, but it seems like, again, we tend to see it a little bit in the younger Dalmatians, so, but I would just do routine health screens.
Dr. Tweet, in some conversations, and obviously a lot of people ask me lots of questions. I'm not an expert, although I live with it. But the question came, would any dog possibly have copper in their liver? I think you've probably answered that in your talk, but so it would not be unusual for every dog that was biopsied to possibly have some level of copper in their liver.
Oh yeah, what we know is normal coppers are probably 120 to 400. And even if you do a little copper stain, you'll see some little copper granules. We think that's normal.
So people don't need to be alarmed.
The answer we don't know is at what point is it, what's the cutoff, and this is disease, and below that is not disease. We don't know that yet. Yes?
You said that many things could raise the ALT level
Correct.
artificially. Is there anything that an owner should do before they have their dog tested that would by mistake raise that level?
Well, usually the question is, what would raise the ALT level? And there are a number of things that actually, if an animal has gastroenteritis, the liver can be secondarily affected and the ALT levels are go up. Sometimes medications. So there are a whole number of different things that can do that. So as a veterinarian, if we see an abnormal blood value, no matter what it is, we usually try to figure out, well, what's going on, what might have caused it, how do we best approach it. If we can't find anything, and it was abnormal, I would probably just repeat it again, and I think the recommendation is about 2 months. And if it's still abnormal and you can't explain it, then what you want to do is maybe further investigate that. I usually say that chronic hepatitis is kind of a silent killer because you usually don't start to see signs until, we can do surgery and take out half a dog's liver and just throw it in the garbage can if we wanted to. We would never do that, and they still will maintain, all their function stuff. It's when you get more and more damage. And so identification early is probably important. Yes?
Elizabeth Zadell asks, I have produced a dog with CSD and they have had 2 liver biopsies and been on penicillamine for several years. There was no reduction in the copper. It has up and down days. Are there any other meds to help reduce the copper? The dog is on a low copper diet.
Well, right now, the drug that we usually use for copper is penicillin. And that's the one that is readily available. There is some research looking at ammonium thiomolybdenate, which is given orally and with a meal and without a meal. Very early research. We have very limited experience with that. That may be something that, again, would have to be gotten from a compounding pharmacy. It's not, you can't write a prescription for it. They do use it in humans with Wilson's disease when they get the copper in their brain, and that seems to be the treatment of choice for those people. So right now, the only thing we have is penicillin. Yes?
They're writing questions faster than I can ask.
Recommend starting the testing to see what their coverage levels are?
Probably, I usually don't do it under a year of age, and probably between that 1 and 2 years of age. Probably minimum would be 2 years of age. You can just go and get your routine health screen. Yes?
I've lost a total of 3 pets, or 3, I should say dogs, because 2 of them, they're all siblings. And they, and well, actually one was from rebreeding, but 2 of them were only a year and a half of age, and then one was about 6.5 years of age. So that's why to me it is important to keep screening.
Yeah. Oh, absolutely.
Because you really don't know.
So her comment is she had one that was 1.5 years.
2 that were only about a year and a half old, and one that was 6.5 years old.
One more question?
Is there data of dogs with CSD from foreign countries? Is there any data that we have? Besides, I know Canada.
Canada, I guess that's a foreign country.
Yeah. That was helpful over here for me.
Some of my friends at University of Utrecht in the Netherlands, I think, have seen some Dalmatians. Now, I don't know if they came from the U.S. or they've been bred there. They were very interested in the genetic aspects as well.
I can tell you, we've been contacted by some people from Australia, and also,
Oh yeah, I'm dealing with a dog in Australia that was a veterinarian. It's her own dog, and it's got the copper storage.
another question that's been posed about small livers. There was questions of, small livers, the difference in size of a liver for a dog, or is a small liver a part of the diagnosis of a damaged liver?
So is a small liver a damaged liver? Well, there are a number of things that can cause small livers, and actually it's very difficult with an x-ray or an ultrasound to say, oh, this is a small liver. And there are studies where they actually, at a necropsy, they've taken the liver out and they measure it and weigh it, and they know, based on previous studies, if that weight is too much or less. With severe damage to the liver, where all the liver cells die very rapidly, the liver can get small in size. But just taking an x-ray and saying, oh, this is a small liver, that doesn't mean much to you at all. Yes?
So I have a female with copper storage disease, so when her mother passed at 14 and a half, we had a necropsy done on her liver. She was never affected. There were small amounts of copper in that liver, but that would not necessarily, that could be just a normal kind of thing.
It could be a normal thing, and I would think a dog that, if it was affected by the age of 14, would have significant stuff. So a small amount of copper, is normal. You have one more?
Yeah, one more, and that's it, I promise. Let me get to it back. Sorry. Do you recommend a liver biopsy on your breeding stock?
No, I guess I would do genetic testing and
Okay.
screening. But we don't have genetic testing yet. But that's, I will tell you, that's what we used to do, you know, with the Bedlington Terriers years ago. People would get a litter of puppies, wait until they're a year of age, and then we would biopsy them and determine if they're affected or not affected. But I think you could use the liver enzymes as maybe a sentinel for something going on. One more question, then I gotta leave. Unfortunately, yeah.
In the biopsies that were done out of 22 dogs, you said that there was one that was determined to be a carrier. How was that determined?
Well, that was just determined based on looking at the pedigrees that we were looking at, so we suspected that. And it had normal copper levels.
Again, thank you very much.